get started.
Perfect.
Thank you.
No problem. All right. Okay, can I, let me push the right button. Okay, can everyone see my screen all right?
Yeah.
Perfect. Okay, so I want to first, again, start off by introducing myself. I'm Chelsea. We also have Sally on the line. We both are very involved in the day-to-day processing of the PEBB employer, the PEBB FSA and DCAP plans. And today we, of course, are talking to you guys as the employers to go through commonly asked questions when it comes to open enrollment, any nuances or changes, and then hopefully this education session will help you to answer any questions that you're going to get from employees, of course, during the month of November when we know benefits are on top of everyone's mind. So first, to start with, I want to give you a quick overview. Navia does administer 3 different benefits for the PEBB plan. The first we'll be referring to as medical FSA or just FSA. That is a flexible spending arrangement. The other is the Dependent Care Assistance Program, or we refer to it as DCAP. And the third is, we call it the Limited Purpose FSA, or sometimes abbreviated to LPFSA. These benefits, what they have in common is that they are all personal spending accounts. They allow participants to set aside a portion of their salaries pre-tax to pay for eligible expenses. I'm sorry, I was getting distracted by my screens. You are seeing the white PowerPoint slide with the debit card picture on it, correct?
Correct.
Okay, perfect. My Zoom is not cooperating with me. Okay. So first off, I want to start with kind of how the benefits work. And with these 3 benefits, we're going to talk about how they are similar and then also how they differ, because they do each differ slightly from each other. But what's the same is that every participant who wants to participate in these benefits, they will have to enroll every year. It is not a passive enrollment. It is an active enrollment. They have to choose every year if they want to participate. So during the open enrollment timeframe, they're going to choose their total annual election amount that they would like to put into these benefits. And then that amount will be deducted from them every paycheck. So you guys, when you are setting up their payroll deductions, will take their total annual election and divide it by the number of paychecks they have for the year. And then from the member's perspective, the funds are available immediately for the medical FSA and limited purpose FSA. Those are what's kind of known as a pre-funded account. So they'll have access to the full benefit right up front in January. And then for DCAP, the funds are available as the payroll deductions are actually taken. So that benefit is more like your own personal bank account. You can't spend the funds until they've been deducted from your paycheck. And then lastly, on the members' end, they want to spend the money so they can pay using their Navia debit card or submitting reimbursement claims for those eligible expenses. Another important thing to point out with the benefits overview here, again, is that they're very similar, but there are differences. And so a couple of the big differences come to the amount of money you can put into these benefits. There's an annual election maximum. And for the plan year 2024, for the medical FSA and the limited purpose, those maximums are the same, $3,050. But for the DCAP benefit, it is $5,000. And then all 3 benefits have the same minimum. So if an employee is trying to enroll, their total election for the year has to be at least $120. They can't enroll for a very minuscule amount like $25 or $50. It has to be at least $120 for the year. And then there is also an HSA, we know, that is administered by another vendor that the Healthcare Authority works with. So it is important to note that any employee who enrolls in an HSA benefit or who is receiving employer funding into the HSA due to their compatible high deductible plan, if they're in that benefit and participating, they are not eligible to enroll in the medical FSA. They could enroll in the limited purpose FSA or the DCAP, just not the medical. And the reason there really relates to the eligible expense types. So for medical FSA, it covers anything you can think of related to medical, dental, or vision expenses, sort of those 3 big categories. And then the limited purpose FSA, why it's called limited, is that it cuts out the medical expenses. Only dental, vision, orthodontia type expenses are eligible with the limited FSA. And the reason for that is because that plan is compatible with the HSA. And of course, it would be you have your HSA funds to spend on the medical expenses. And then dependent care. Now, some folks might get confused and think dependent care means healthcare expenses for their dependents. We get that question probably a couple times a year, but what it actually is it's dependent care as in daycare expenses. So if you have a babysitter or a nanny, or your child goes to a daycare facility, those are the costs that an employee would use a DCAP benefit for. There is also very specific requirements around elder care too. Some employees may qualify to use the DCAP for elder care. And then the carryover provision. So that's a feature of the plan that is somewhat new. Those of you who've been, with PEBB for a while know that there used to be a grace period on the plan. And then just within the last couple of years, we've switched to carryover. So we're going to go a little bit more in detail on that feature here in a couple of slides. But it is important to call out first and foremost that the carryover only applies to the medical FSA and the limited FSA, not to the DCAP benefit. All right, so as I said, the carryover, again, any unused medical or limited medical FSA funds are going to be able to carry over, but there are restrictions on the dollar amounts. So there's a maximum of $610 that can roll over. And then that would roll over. What we're talking about right now is the 2024 plan year. So that's why you're seeing 2025 listed here. So this means if someone has money left at the end of 2024, it will be eligible to carry over into 2025's plan year. So as long as it is the maximum or less, and there is also that minimum on the plan. As we described, you have to at least enroll for $120 on these plans. And so if you do not enroll in 2025 for at least $120, you will not be eligible for your carryover. It will be forfeited. And then similarly, if your amount left in 2024 is higher than $610, you will only get the $610 rolled over and the rest will be forfeited. Okay, so getting a little more in the weeds on how carryover works. Again, you can carry over a maximum of $610 after the end of 2024. Again, it only applies to medical and limited purpose. We are going to talk a little bit more in detail about the employer funding for represented employees of the collective bargaining agreement, or you'll see it abbreviated here as CBA. So it's just an important call out that those 250 CBA funds are treated the same as payroll deductions for those employees, and therefore they are eligible for the carryover as well. Again, just calling out, the carryover is not part of the DCAP benefit. And then again, the minimum. So you're only eligible to receive carryover if you're enrolled in 2025 for at least $120, or if you have at least 120 left in your 2024 FSA. Basically, the point is that you can't be enrolled in a new plan year unless you have at least $120. So if your carryover will get you there, then that can enroll you. Otherwise, if your carryover is only, let's say, $25 and you didn't enroll already, then you're not going to meet that minimum. So you won't be able to receive your carryover. Okay, and then this is an important call out, again, going back to those employees who enroll in the consumer directed health plan with the HSA for 2025. They are still eligible to receive carryover funds if they have money left in their medical FSA at the end of the year, but their carryover could only be posted into a limited purpose FSA, again, because only that benefit is compatible with the HSA. Okay, so let's talk about some dates now. What we have listed here is both plan years because in general, what we're talking about today is the 2024 plan year because of course, open enrollment's coming up and that's really what's on people's minds. But it is important to call out that we're still in the current plan year as well. So we want to make sure that you have a clear distinction between both dates. So in the current 2023 plan year, it is a calendar plan year. So of course it goes from January 1 to December 31. And then there is what's known as a claims run out period, which gives employees, or no, I'm sorry, let's go last day to incur. So the end of the plan year, 12/31, is the last day to incur services. And incur, in case employees ask you that question, it really means to purchase the item or have the service. So if I'm incurring the service, it means I have to have that doctor's appointment no later than 12/31/2023. Or I need to purchase that eligible item no later than 12/31/2023. And then what I was getting into is the claims run out period. So let's say I had a doctor's appointment on 12/31. It's very likely that doctor is not going to bill me for a couple of weeks, perhaps even a couple of months it might take to get my explanation of benefits for my insurance. So that's why your employees have until March 31st of 2024, during which they can submit the claim for any service they had back in 2023. Okay, and then you'll notice for 2024, the deadlines are not changing. They're merely just changed to accommodate the new plan year, but there's really no edit. So they're going to have the same calendar year plan to incur expenses, and then the same 3-month claims run out period through March 31st of the following year to submit those claims. Right. Okay, so I said we were going to talk a little more about those CBA folks. And so here is where we've got a lot more information. The $250 medical FSA contribution, again, is only provided to represented PEBB employees as part of the negotiated collective bargaining agreement. So there is only a certain subset of PEBB employees who qualify for this $250. And those employees, their annual rate of pay, one of the qualifiers is that their annual rate of pay on November 1st must be $60,000 or less in order to be eligible. And then there are other factors as well. So I know that Navia and I know you guys as the employers tend to get those questions of, oh, I got the money last year. Am I going to get it again this year? Am I eligible? I think I should be eligible, but it's not showing up for me. These really are the requirements to walk through. And HCA, I believe, is the correct contact there to help troubleshoot if you think someone should be eligible, but they're not showing up. They can walk through those requirements more in depth with you and say, this is why that person does or does not qualify. So yeah, a couple more to just go over really quickly. Again, they can't be enrolled in the CDHP plan with an HSA for 2024. They can't waive the PEBB medical coverage unless they waive to enroll as a dependent on someone else's PEBB plan. They're not eligible if they terminate, retire, or lose coverage. And if the PEBB employee is eligible and they have not already enrolled in the medical FSA for 2024, then they will automatically receive the $250 loaded onto onto a Navia debit card in January. So a common question that employers tend to get around open enrollment time or even December is folks getting anxious. Like they know that they're eligible for the 250 and they have not seen it yet. So it's important to note that those funds do not actually get loaded to Navia until closer to the end of January. And so at that time, that's when their election will be in the system. They'll get a welcome notification from us and they will get issued a debit card that has that $250 balance. And then that being said, they don't have to only participate with the 250. They could also choose to have their own payroll deductions on top of that. So the last bullet here just explains that if they are eligible for the 250 and they enroll in the medical FSA for 2024, then the 250 will just be added right on top of that election they made. Again, they won't see that show up until closer to the end of January. So All right. Now let's talk a little bit about what members and employers are expected to do during open enrollment. So first is that there are multiple options that your employees can choose as far as how they can submit their enrollment. The first and most preferred, most streamlined way to go is going to be online enrollment. So there are some of you, namely UW and Wazoo. If any of you guys are from UW or Wazoo on the call today, you know that you guys implement a system called Workday. And so your employees, in order to enroll in the FSA and DCAP, will need to go online to through their Workday system. That's how they'll submit their enrollment. For the rest of you guys, your employees can do that same online enrollment, but through Navia's portal. So you'll see the link right here, peb.naviabenefits.com. And that website, once they log in, that is where they'll be able to enroll and enroll for the new year, and they'll get their confirmation email. So we highly recommend using the online option because it's, of course, easiest, clearest for employees. They can change it at any time during open enrollment very easily. They can just log back in and make a change if they need to. But if that's absolutely not an option for the employee, they don't, like the idea of going online, they don't have a computer at home, something like that, they can certainly complete a paper enrollment form. So that's option 2, would be a paper enrollment form. And I'm going to show you a little demo of the PEB website where they can find a copy of that form. And you guys can feel free to, find the copy there and download it for your employees as well. But once it is filled out, the employee just needs to fill it out. And then during open enrollment, they can send it directly to Navia at either the email address or the fax number you're seeing on the screen now. They do not have to return it to you as the employer if they're during the open enrollment timeframe. However, some people do. Some employees would prefer it to go to their employer. Some employers prefer to collect them. That's perfectly okay. We just ask that as the employers, you guys submit those to Navia as soon as possible when you get them. You'll start to see weekly notifications during the month of November, letting you know, hey, don't hold on to those stacks of forms, send them to Navia ASAP. And that is just to make sure we can get through processing them as quickly as possible, and we don't end up with a backlog at the end of November. And then again, I'm sure you all know this, but just to reiterate, your open enrollment timeframe for PEB employees is November 1st through November 30th. So crazy to think it's right around the corner already. But keep in mind that all enrollments must be received by Navia or you as the employer no later than November 30th. All right, so that's really, your deadlines for your employees, and diving a bit more into your responsibilities as the employer during open enrollment. Some of this we covered already, so I'll go over a little quickly, but again, submit your open enrollment forms to Navia as soon as possible. You can send batches every day if you want, but at least once a week is preferred there. And you guys can, of course, email them again or fax them to the same email address and fax number you're seeing on the screen. They must be received by you no later than November 30th. And then if let's say you as the employer had an employee who was falling behind and they turned in a form, it's on your desk, it's 5 p.m. on November 30th, you as the employer can certainly submit that to Navia still the following day. But you want to make sure that it's noted on the form that you did receive it on time. As long as the employee got it into you on time, then we can take it. But if that same employee were just to send Navia a form on December 1st, we would not be able to accept it because that is past the deadline. So something to keep in mind. And then your next responsibility will, of course, be to set up those payroll deductions for the first payroll in January 2024. One exception there is agencies that use the HRMS payroll system. Navia does have a custom relationship there where we initiate the payroll deduction amounts. So you guys don't have really anything to do there for yourselves. We'll send that file over as usual. And then a lot of people ask, well, how do I set up my payroll deductions if the employees sent their enrollments directly to Navia? I don't know what they enrolled for or who enrolled. And that's perfectly valid. And so we have a system in place that Navia will send a file to you as the employer with all of your employees' 2024 enrollments. And that will come in the week of December 12th. So it'll be after open enrollment is done, after everything's processed, then you'll get a file. But of course, if all of your employees are sending their forms to you instead of directly to Navia, you can go ahead and be recording those as you go. You don't have to wait for our file on December 12th to get those deductions entered. And then of course, once your payroll deductions begin, then it is your responsibility to report those deductions via your standard file feed, just as you do this year to Navia every pay period. And same as this year, your payment for those contributions is sent to the HCA. So through your normal methods, nothing's changing there. And then I will show you this page on the website here in just a moment, or we might as well do it now, actually. Go ahead and click on this link in the PowerPoint. Takes us to peb.naviabenefits.com. And up at the top, it took us to the forms page. So here's where you're going to see listed the current year's forms. So right now that means 2023, and then next year's forms, 2024. We try to make that pretty clear by having the date there. You're going to notice if you come on here today, being that it's October 27th, you will not find the open enrollment form. And that is because we do not want people getting it in their hands before open enrollment begins, because of course, as we know, those deadlines are so strict, you can't turn it in before or after. So as of first thing in the morning on November 1st, that is when you and your employees will see the option to download the open enrollment form right here on the website. But in the meantime, if anyone has questions, especially with benefit fairs going on right now, you can always direct them to this site because there's lots of great resources. The enrollment guides are packets that actually go into the details of how each benefit works. And so it's a great time for employees right now to be brushing up on that stuff to decide if they want to enroll and for how much. All right. And then as you can see on that page, or as I just showed, the forms are very specific to the individual plan years. So you just want to make sure that during this overlapping time of November and December, if you have an employee who is actually trying to enroll for 2023, you want to make sure they are using the 2023 mid-year enrollment form. So just showing my screen here again, that's going to be this one right at the top. And that person's enrollment would only be valid from the time they enroll now through the end of December of this year. So you want to make sure that you note that in payroll and that they're aware, that they have to spend their funds during this plan year. If they are trying to enroll for 2024, they would use that 2024 form that's not available yet. All right. A lot of this is kind of just rehashing what we've said. So just some quick bullet points. Make sure you're submitting the forms to Navia as soon as possible. These are the email address and fax number to submit them to. All forms outside of the open enrollment form actually do require an employer signature. So keep that in mind for those folks who do want to enroll mid-year or who are going through an agency transfer or change in status, any of those forms. Note that they have to send those to you to be reviewed and signed prior to them coming to Navia. It's only the open enrollment forms that can be sent directly to Navia. Again, forms are specific to the plan year. Begin and modify payroll deductions on the next pay date, report payroll deductions to Navia every pay period, and then send payment for those payroll deductions to HCA. So again, all the same stuff that you're doing currently this year will continue in 2024. Again, resource page for the forms is there. And then the key forms we kind of just talked a little bit about, but open enrollment form, mid-year enrollment, change in status and agency transfer, those are typically ones that come up more in the middle of the year. And a change in status would be if someone's experiencing a special open enrollment event that allows them to make a change to their FSA or DCAP. That's when they would want to use that form. And then agency transfer is for anyone who is working for a PEB agency and then they transfer employment to a different PEB agency within the same plan year. As long as they meet certain eligibility requirements, then they are able to just transfer their existing FSA DCAP enrollment from their one employer to the next. We just want to make sure that, again, the enrollment guide covers those specifics, and the agency transfer form is what they'd need to fill out and submit to their new agency in that situation. Okay, so for you guys as the administrators, I know this is a lot of information, but I do want you to know that we're here at Navia to help you through this whole process, and you have a dedicated team of account managers available to assist you. So if you have employees coming to you with questions, you can of course send them to our customer service team or have them attend a benefit fair. Those are great places to get their questions answered. Or if you yourself as the employer need to know the answer to that question too, you can use our phone number and email address that you see listed here on the screen, again, specifically for you as employers to reach your account management team. We highly recommend email as just, especially this time of year, as we all know, it can get so busy. Email is our quickest way to respond. So going to that ES Team 4 email address. And what that does too is that email address goes directly to your account managers, whereas the phone number, you can certainly call the 425 number you see on the screen, but it won't go directly to your team. You will have to let the person who answers the phone know that you're calling from the PEB program, and then you'll get transferred to the available account management team. So just might be a little easier sometimes to send your email, and we can always get on a quick call with you if that's needed. All right, and we are local here in Washington, and our phones are open from 7 a.m. to 5 p.m. Monday through Friday. Okay, well, I'm going to go ahead and switch back to this screen here in case anyone wants to jot that contact information down or take a screenshot. I do believe that this presentation is going to be sent out afterwards, as well as a recording of this webinar. So you do have other resources if you forget to jot these down. But now I'm happy to open it up for some Q&A. Were there any, Sally, that came through that we want to chat about?
There aren't any unanswered questions, but something we got a few questions about the transfer process for employees who, were working for one PEB agency during part of the year, and then they change employment, they move to a different agency that's also using the PEB program. So I think it might be helpful to just take a minute. I can sort of verbally go over what that process looks like. So an important thing to know about the FSA and DCAP when it comes to transferring between PEB employers is that the FSA and DCAP doesn't transfer automatically. I believe some of the other benefits do, but that is not the case with FSA and DCAP. Essentially, when employees who are participating in PEB, FSA, or DCAP move to a new PEB agency and they want to continue their benefit, they do need to actually re-enroll, and they would do that by submitting a transfer form to you guys. Now, somebody pointed out, because they were asking if the person gets terminated when they transfer, and the answer is technically yes, that's how it should work. How it is kind of intended to work is when someone leaves their prior agency, a termination would get reported to us. We'd put a term date on their benefit, and then they would submit the transfer form when they want to re-enroll. And when we do that, we take the termination date off the benefit, and that would resume the benefit where they left off. But in reality, sometimes if the employee really has like absolutely no gap in coverage, it's a very quick transfer, especially if it's between agencies that are under that HRMS payroll system, or for the like community and technical colleges, where they're all in that kind of same consolidated payroll system. Navia may never receive the term date, and it may kind of just flow over naturally. That's okay. We still just would recommend that if an employee wants to resume their FSA or DCAP benefit, that they do submit that transfer form. And we can just, 100% make sure that they are set up and good to go and their benefit is active. Okay, we've got a couple more questions that have come in while I was talking. First one, did the rollover change for 2024 change from 570 to 610? Yes, so the carryover limit from 22 to 23 was $570. That limit went up to 610 for 2023 to 2024. So that's the limit folks are going to have on the money moving from this year into next year. And then as far as we know right now, that limit is remaining 610 from 24 to 25. The IRS may choose to increase the limit, but they haven't announced that yet. So at the moment, it's 610. If that does change, we will update all the materials. You would be notified. Okay. Next question here is, if an employee decided not to enroll in an FSA program when they were first hired, but decided to enroll during open enrollment, are they still able to enroll online, or do they need to submit the paper form? No, they can enroll online. That is totally still open to them. Yeah, the paper forms are really only required when if somebody is a mid-year hire and they're wanting to sign up for that benefit mid-year, or they had a special open enrollment event that allowed them to make a mid-year change. Okay, if an employee starts employment in November and wants to enroll into an FSA plan, will they need to submit 2 forms for 23 and 24? Yes, that is correct. So if they get hired in November, they'll want to use the standard open enrollment process to sign up for 24. That means going online or submitting that 2024 open enrollment form. But for 23, what they would need to do is submit the 23 mid-year enrollment form, and that has to be done via form. They can't do it online. Something to keep in mind though, if you've got employees talking to you about signing up these kind of late in the year new hires, is to keep in mind that they don't have a lot of time left in the year to spend down their funds. They also don't have a lot of time for payroll deductions. So something we kind of always encounter at the end of the year is folks who get hired and their benefits are effective, for example, December 1st. And they want to sign up for, they just kind of unthinkingly sign up for the full maximum, right? Like they sign up for the $2,000 or something. And they realize that if they sign up effective December 1st, at most they're going to have 2 payrolls to fund that $2,000. And so that's $1,000 per paycheck. And you can see where there are some problems there. So something you may, if you get employees asking you about that, is making sure they're aware of the time frame, that there isn't a whole lot of time left in the year. And also too, the reality is that if you've got employees, even if they were eligible to effective December 1st, and they come to you and they turn in their form on, let's say, December 20th, at that point, it's really too late to enroll. There's really no way to get them in on a final payroll. 2023 is kind of done for them. They could still enroll for 24, but yeah, it's just, you want to be very aware of the time frame and how many payrolls are left for these late year new hires. All right. I think that is all the questions that have been typed in the chat. Any other questions?
Great.
Okay, not seeing. Yeah.
I was going to say they're making it too easy on us.